Welcome to this webinar. The topic of this one is acupuncture for the feet, and we're going to be integrating myofascial anatomy, TCM, and Master Tong's points into this. We're also going to be discussing biomechanics as well. And, biomechanics is a whole thing, but I've found that by equating meridians to myofascial lines, because they overlap so precisely, and then understanding the anatomy of those myofascial lines and what muscles are on each line, then we can start to understand the functional anatomy and the way that these muscles and the muscles on these lines function together. And through that, we can then better understand the biomechanics. And this is really important for most of the common things that we see in clinic, because structural problems do exist, and some fields of medicine are orientated primarily in that direction, where they're addressing structural conditions. And I want to make it clear, though, that these myofascial lines, they give us a much better handle really on all aspects of acupuncture, not just structural conditions, but also internal medicine and basically everything under the sun. So we're going to be discussing biomechanics a bit tonight. And I think that's a really important thing that acupuncturists, at least many of us, maybe need to understand better. And through doing that, it allows us to understand the function of the points better. So there's this relationship between structure and function. And the more we understand the structure and the anatomy of myofascial lines and meridians, then the better handle we have on the function as well. Okay. Now, this is really interesting when we look at the palmar side of the hand, and along the edge of the thumb, we find that there's a lot of points that we can use for foot conditions along the edge of the thumb around lung 10. So right here, this point in the middle of the first metacarpal bone, that's lung 10. And in the Tong system, they use it as a unit of 3 points. So lung 10, and then just proximal and distal to that, we've got 2 other points. Now, one thing I want to address too, that I do sometimes hear, and I think this is a common problem that acupuncturists struggle with sometimes, is we do the acupuncture and then the patient gets relief for however long, a few days, maybe just a day, maybe 3 days, maybe a week, and then the pain comes back. And so if we want to get improvement in results and get longer lasting results, and if you find that that's a problem that you have, where you're doing acupuncture and then they get relief, but it only lasts for a few days and then the pain comes back, if you find that that's happening, then it really helps to understand the myofascial lines and the biomechanics. Because if you don't correct some of the structural imbalances that are present, then it's just so easy that the symptoms will return. So some of the biomechanic fundamentals that we should talk about, I just want to quickly go through this and then we'll get into the points soon, okay? Is that when we're treating the feet, we should pay attention to the knees and the hips, okay? Because sometimes problems within the feet will actually originate in the hips or in the knee, okay? And when treating the knees, we need to pay attention to the hips and the feet. And when treating the hips, we need to pay attention to the feet and the knees, okay? So we know that where a symptom occurs is not always where the root problem's at, right? So symptoms are often indicating that there's a problem in a connected structure that's down the line or down the meridian. And this is why distal points can work so well too. And this gives us a lot of leverage in a lot of different ways when we understand these principles. Some of the things that we're going to cover and some of the foot disorders we're going to talk about in this class and tonight include overpronation or collapsed arches. I'll use those terms interchangeably. So when a person has overpronation or a collapsed arch, that often causes pain in the medial arch along the spleen meridian from like spleen 3 to spleen 4. And then this also places strain on the plantar fascia as well. We're going to be speaking about pain in the ball of the foot, or what's otherwise known as stone bruise. And this is just pain in the balls of the feet. We'll be speaking about this tonight. I've pre-recorded a lot of material already on overpronation and collapsed arches. There's 3 videos in the course on that talk about 3 different patterns and things that you need to know about that. So tonight we're going to spend a lot of the time on the ball pain and Morton's neuroma as well. So this is just a summary. We're going to start talking about the acupuncture points now. I've briefly mentioned biomechanics and movement and how that's important, and we're going to be discussing some of the details of how to treat these various conditions, okay?